Do you know what's so funny? The other day, I decided I was going to make some beef korma. I don't know. Do you ever like crave a dish that your mom made and you literally can't eat it? It's so upsetting. And you can't buy it anywhere, like at least not the Afghan way. And so I made it and then I ate it for dinner and it literally tasted like nothing.
What?
I was like, why does this only taste like beef and potatoes? Why doesn't it have like flavor? You know what I mean?
Why doesn't it have the love?
No. Alrighty. Well, that all being said, hello and welcome all of our lovely listeners for Bundle of Hers. This is Lily, one of your new hosts, telling you a little bit more about me and my story. So I'm so excited to have Miriam on with me because she is literally my soul sister and we're cut from the same Persian rug. And I feel like we have a lot of lived similarities. So I'm so excited that you're going to talk with me today.
Me too. I love that whole like cut from the same Persian rug. Like I'm going to steal that. I'm taking that.
That's how I picture us. You know how they like draw out the designs on the rugs? We're just like two of the girls on the rugs.
On the rugs. I love that. That's beautiful.
Hung on the ceiling like the parents do.
Exactly. Only way to do it.
I feel like today I really wanted to talk a lot about growing up brown, especially in the different states that we did and just what that was like for us. And then just talking more about how that really shaped our perceptions of the medical system and our path into medicine and how we kind of figured out that we wanted to be here and where our space was. And I just felt like you would be the perfect person to talk about this with because even though we grew up on like opposite sides of the like states, I just feel like we have a lot of things that we grew up with that were very similar. So I'm excited that you're here.
I'm excited to be here. Thank you for inviting me. So honored. I feel like you're probably my favorite person to have as like a co-host. Maybe I shouldn't be picking favorites.
There are no favorites.
Yeah, there are no favorites.
We just talk so much anyways. It's fine.
I think it's because we come from similar backgrounds and it's always like a really, I think, healing conversation. I do want to say, just like a caveat, not caveat, but what's the right word? Just like a little
disclaimer,
clarification. No, clarification is the word for our listeners. So when we say growing up brown, because me and Lily, like we just like talk like we talk with each other, we mean like as like brown women of color, like women of Middle Eastern ancestry. That's what we mean. And that's really what we're going to center on. So in case any of you were like, what does that mean? We're talking about just our experiences as brown women of color.
I love that. Good point. And before we dive into our conversation for today, I also did want to put out a disclaimer that all of the opinions and thoughts that we share on this episode are those of our own and they don't represent any type of institution or employer. And we just wanted to share our personal experiences with you all listening at home or in the car or wherever you are right now. So that all being said, the biggest thing that I wanted to just start off talking about is our upbringing and our early interactions with the medical system and what that looked like. So I'd love to hear from you, Miriam, just like what it was like growing up in Georgia.
No. Well, I talk a lot about this on the podcast, but to like quickly summarize, not great. I mean, okay, complicated, right? I grew up in like what I call middle of nowhere, Georgia. It was like central Georgia area. Wasn't a huge, as you can imagine, Middle Eastern population. And so I never really had like a great sense of like who I was unless like I was at home with my family. But even then it was confusing. And if you guys want more clarification on that, shout out to my identity series episode, the assimilation episode. That one kind of goes more into like my experiences growing up. But I will say it was really challenging because when you are from like a background that's different than the rest of your community, it becomes very obvious from a very young age and sometimes not in the most positive ways. And so I think growing up, there was a lot of just like feeling like an outsider, feeling like I needed to fit in and kind of like assimilate, right? Which is what that whole episode was about. Yeah. So it was kind of a challenging experience, to say the least. What about for you? What was it like here in Salt Lake?
I was one of 3 brown kids in my elementary school and definitely like on the lower socioeconomic status of my elementary school since we were like located up in like the foothills of Salt Lake. For those of you who like have visited Utah, some of those houses can be very big. And meanwhile, I was, starting kindergarten and I remember like 9/11 had happened right around that time. And it's weird because I was like maybe 5 and I shouldn't have like very vivid memories at that point, but that's something that's like super etched into my mind. And I can go back to like that exact moment in my head, as I think a lot of people can, and they just remember like where you were and what you're doing at that time. And I remember my mom was driving me to school and she was like, if anyone asks you where you're from, what religion you are, don't tell them. Say you don't have one, that you grew up in Utah, that you're from Utah, that you're like you're a Utahn. And if they ask anything further, just say, no, I'm from here. And it was really confusing to me because we had like religious books in my home and paintings, and even like in our cars, we had little things that like are supposed to protect you when you're driving. And my mom just like went through and like took everything down, and I could tell that she was really afraid. And I just thought it was like unfair and wrong that like we weren't able to be our authentic selves. And I remember thinking my mom was being really paranoid, and I felt like she was just being, you know, like an anxious mom, as many moms are. And so I went to school thinking nothing of it. And then in my like primary class, I remember one of my classmates, which were literally like 5 and 6, and I feel like a lot of the things we say are most likely regurgitated from like our parents, you know. And he like turned around to the group of students I was sitting with, and he was like, I think that we should just all bomb Afghanistan so that everyone dies, and that way like this will never happen. And I just remember being in like so much shock hearing that, because like I grew up knowing that I had family in Afghanistan, and I grew up knowing that I had cousins who had passed away from rockets falling on their homes. And it was something that was just like so upsetting to me that I was like, there's no way like that we can speak like this unless we're hearing it from like our parents at home. And I started to feel really unsafe, which I don't know if you felt that way too, but I just felt like, yeah, I really have to assimilate, and I have to like hide who I am in fear of like any type of repercussions happening to me, or like violence happening to me just going to school.
Yeah. Or our families, honestly, like very similar. This is like so funny because we're talking about like how we had so much in common. And I feel like I just like distinctly remember, and my mom actually just stopped doing this because people will ask like, where are you guys from? You know, because we look different, or at least we look different in that area of the country. Right. And they would ask all the time. And like, I would be like 5, 6 years old, like really like in that post, like in that 9/11 era, like, especially when my parents were just like so worried about our safety. And my mom would just lie and just like pretend like she was like a different ethnicity. She would like make up like, which is like questionable, like odd. If anybody listening is like, Mama is Sadian, what? But like it was really a protective measure because we knew that being identified with like as any Muslim identity, especially Afghans, was particularly dangerous in the part of the country that we grew up in. And for those of you that are listening that are like, oh, that might be an over exaggeration, it totally wasn't. People were being hate crimed all over the place. Like those were real experiences. Lives were lost. And my parents were so aware of that. And my parents were like strong, courageous people for leaving their countries and coming and starting new here. So for them to be scared is like saying something.
I agree. I like remember my cousins in Canada, like they got mugged and jumped and like all these horrible things like growing up, and it was because they were brown men. And I felt like growing up, like I very much needed to just like blend in with the crowd. And even to this day, like we hear these like awful news stories about like Palestinians being shot in Vermont. And a lot of times I think sometimes like that fear that we have, people think is like us just being really paranoid or fearful about like a threat that doesn't actually exist. But even when I was in college, I remember hearing stories about people's hijabs getting ripped off and just like all these horrible things where you think like, no, this is very real. And people do get like horrible violence directed towards them simply because of like who we are and where we live. And that's really scary.
Yeah. We were just talking about this before the podcast, but I think it really goes down to growing up with an identity that's like heavily politicized. Is that the word, politicized? Like heavily political, right? You're from a country that and let's just be real, most Americans, like when they hear Afghanistan, they think of war, they think of terrorists, they think of 9/11, they think of all these things. You know, from a young age, you are so super aware of that and how other people perceive you before anything else.
One of my friends, I like showed her pictures of what Afghanistan looked like in the 70s when like our moms lived there. And my mom would wear like big hot pink hoop earrings and cute skirts. And she had like a perm in her hair. And they were just like walking downtown. And my friend was like, oh my gosh, I never knew that like Afghanistan looked like that, because we had paved roads and cities and women dressed fashionably. And I was like, this is what my country looks like to me in my eyes. But obviously what we see today, like you would never imagine that that's what it looked like once upon a time.
I know. And it's just beautiful. I mean, people come from all over the world to Utah to hike. And like Afghanistan actually very much so resembles Utah in a lot of ways. Like
I think that too.
I honestly feel like a lot of the Afghans that end up here just stay here because it like for the first time, like my mom was flying in to visit me for the first time years ago. And she was like, oh my God, Betchim, the mountains are just like Kabul. It was so funny because I took her on so many hikes and she was like, this is exactly like this reminds me of. Yeah. So Afghanistan is so beautiful. And yeah.
Oh man.
We could like, this is just turning into Afghanistan part 2.
I know, for real. We just love our mother country so much. But kind of going off of that, like, do you feel like you've ever had an experience with the medical system that really impacted like your identity? Because this one's like very, I feel like kind of like a silly example, but I remember it so well because I was so embarrassed. But I had a bone infection, for those of you who like have studied osteomyelitis. I had that when I was 12.
What? No way. I didn't know you had osteomyelitis. That's a serious infection.
I was just a problem child, but I had osteomyelitis. And I remember we went to the emergency room and like my ankle was like killing me and I was like screaming and all these awful things. And my mom, being the Middle Eastern mom she is, she like cracked a raw egg on my ankle. And she was like, the yolk and like all the nutrients, like they're going to cure you. And I just remember being like, Mom, what is this like dripping down my ankle? And we hobble into the ED and the doctor's like looking at my ankle and he was like, why is this so yellow? And now looking back, I was like, he probably thought I was like jaundiced or something. And I was so mortified. And my mom was like, oh, it's nothing. And then I was like, it's an egg. I just remember being like so embarrassed because my mom's like idea of like, you know, treating my disease was doing this. And like the like doctor like treating me was just so confused and he was like wiping it off. And I think he thought we were like completely deranged. But that was the first time that I was like, you know, there's this like weird lack of just like representation in medicine and just like awareness of like cultural differences that causes interaction to just be like so horribly awkward and like just strange, you know?
Yeah, that's such a cute, funny story. Like the ED doc is like, get liver lab stat. She looks jaundiced.
Who knows what she has?
Oh my gosh. Yeah, I feel like growing up, you know, coming from my family, nobody in my family is in medicine. Nobody's a doctor in my family. But I think I can kind of relate to a lot of just like how our family members feel about medicine and healing. And I think my mom still does this to this day. Like, I know that every time like I have any type of physical complaint, and even to this day, like I will know generally how to treat the general things, headache, stomach ache, whatever, right?
Yeah.
She has taken it upon herself every single time to always be like, this is what you do. This is what we did back home and you are going to do it. Like, oh my gosh, I had a UTI. This is so funny. I had a UTI and I was like, I need to go to urgent care and get antibiotics. And she's like, no, what you need to do actually is X, Y, and Z, drink lots of natural herbal remedies to like flush it out. I was like, girl, what? I was like, I need antibiotics. This is going to become pyelo. I'm going to become septic. Like, but I think it's kind of endearing to think about it, but it also is just like a really weird world that we live in, like coming from these two backgrounds. Like one, like we come from our families who have their own way of like thinking about health, medicine, and you know, not to say that like Afghans like didn't have like a medical infrastructure and like hospitals and like practice like medicine in ways that actually like were efficacious. That's not at all what we're implying.
Yeah.
I think it's more, and I think a lot of children of immigrants can kind of relate to this. The ways that our families think about like health and wellness are very spiritual and very culturally oriented and tied to the homeland.
Yeah.
And I think the practices that they grow up with are so much like a part of who we are, and it can feel healing even if they don't like cure your infections, right? Like they can feel very healing. And I think that's something that, you know, now that I'm like in medicine and I know like generally have a good understanding of medicine, is something I can really appreciate, and I think is a really valuable perspective as a future physician.
No, I totally agree. And I also feel like maybe there just hasn't been enough like science and research into these remedies, because there's like this certain fruit that my mom used to always like pick, and she would like boil and then she'd make us eat the seeds. And I swear it cured all my digestive issues. And ever since I like grew up as an adult and I don't know how to buy that fruit and where it is, I have so many digestive issues.
100%. Oh my God.
I mean, look at turmeric.
Yes, turmeric is amazing. So I think every community has healing practices that are rooted in, that are efficacious, like that are rooted in things that aren't just about like, you know, doing something cultural. It's something that's really meaningful that can also be healing.
For me, one of the big things I think about is how every time I went into a doctor's office and I sat in that room, I would get so eager and hopeful that the door was going to open and someone was going to step in that looked like me or looked like my dad and spoke the same language as us and had similar cultural beliefs and experiences that we did. And they would just get it. Like they would understand, like, you know, we don't necessarily shake hands with the women, and they would understand like all of these small little cultural things. And each time the door opened, I just remembered my heart would sink a little and I'd feel a little disappointed just because it never looked like someone that I saw myself in. And so going into medical school, that was the biggest driver for me, was that one day I wanted to open the door, walk into the patient room, and be that face and be that person for another little Afghan girl. And I remember during my family medicine rotation, I was in a clinic who sees a lot of refugees, and I was super stoked because I felt like this was going to be the best experiences I got, is just seeing like such a plethora of different identities. And I walked into a patient room and they were Afghan refugees who had just recently come in the last like 8 months to America. And this was like one of their first doctor's visits. And I just like couldn't wait to like just surprise them, you know? And I walked in and we didn't have an interpreter for that appointment, you know, because not a lot of people speak Farsi. But I remember walking in and I was like, hi, my name is Lily. I'm the medical student. Would you all prefer that I speak in Farsi or English? And I said this in Farsi. And when I walked in, it was a husband, a wife, and like their 2 kids. And one of them was like maybe 8. And she ran up to me and she was just like so in awe, and she just like, her eyes lit up, and it was like the sweetest moment because she like grabbed my badge and she was like, speak Farsi to us. And it was just the cutest thing ever. And I just felt like the whole world had come full circle. And I was like, okay. And I almost felt like at that moment, they felt safe and I felt safe. And like the whole atmosphere in the room just like came down and we all felt very much at peace, especially given the fact that this was like the patient's first ever pelvic exam that she was getting. And I had to explain to her that like, this is the kind of exam we're going to do, which is like possibly taboo in like our culture, but that it's important because we want to look for possible cancer, which is also a scary thing to tell someone that like has never had this exam before. And she was just like, yeah, okay, that sounds fine. Like, that's good. And then as soon as I was like, okay, so like, we're going to step out so you can change and get situated and everything. And she was like, but you're coming back, right? She was like, you're coming back and you're staying in here, right, when it happens. And I was like, of course. And it was just really sweet because I remember thinking how many times it would have been so nice if like my mom would have had someone like that to like be in the doctor's visit and like have that representation and have that commonality. And I was like, this is why I went into medicine.
I love that. Oh my gosh, that little girl was a little Lily. You were like healing your inner child.
Cute.
That's so cute.
It was very healing. And I feel like you've probably had like those experiences too, because we've like talked about them.
The major difference between Lily and I think, is that
what?
Lily, no, girl, you know this. You make fun of me for this all the time. Lily's Dari, which is the Afghan Farsi dialect, is so much better than mine, right? So
no,
I mean, it's true. First of all, I was raised very Iranian like Farsi, and even that is not very good, right? And my Farsi in Dari is so bad, okay? My mom will leave me like voice messages like fully in Dari, and I have to like slow them down. Like I just like I have a hard time, and my speaking is obviously worse. So there was actually like one experience which was with a patient, and she spoke both Pashto and Dari. Pashto is the other language of Afghanistan, and nobody in my family speaks Pashto, but she found out I was Afghan because she straight up just looked at me and she was like, "You're Afghan."
Smelled it on you.
I was like, yeah, I am. Yeah, I was like, I am. And she was speaking to me in Dari, and I was like just answering in just like the most broken, worse Farsi. She stops, and then it says in English, "So do you like speak Farsi?" Or I was like, oh gosh, like, and she was just like roasting me, but it was actually kind of endearing because she was like being funny about it.
Yeah.
She was like, "Girl, you gotta start speaking Dari, like you're an Afghan doctor, like you have to help us, you have to treat us, like you're gonna be, and then she was telling me, she's like, but honestly, like she said, and this is actually something that really like stood out to me and I think is so beautiful about our people. She said, "I'm so proud of you because you are doing it. You are going to be the doctor that like we really need." And I think that was like so beautiful. And then like I go home and I was like, oh gosh, like I really do need to start speaking Farsi because it's actually been a huge goal of mine to be comfortable like with my patients, right? Like instead of just like the formal Farsi that I like speak with my family, that's not like as conversational. And but it was actually like such a beautiful moment because even despite like the discomfort with the language, like she accepted me, right? And she was like, "You are one of us, and like you are like doing the thing that we need." And like she was saying, like, we don't have a lot of people in our community that like were able to become doctors, but you were, and we're so proud of you. And then she asked me if I was married because she was trying to match make me, and I just thought that was so cute.
To find someone for you. She's just like one of those aunties that probably grew up down the street from your family.
She was such an Afghan auntie. She was like, it was so cute. I was like, well, you're my patient, so this is inappropriate. But it was very cute. And I think it was just like again, like a really beautiful experience because I felt like I was part of that community and I was actually doing something for our people. And it was very cute, even though I got roasted, understandably so.
It just makes me think like how privileged people are who like every day or multiple times a week have these types of exchanges with their patients where they have that commonality and they have that connection with them so easily because of just the environment they grew up in and where they live. Whereas for us, they're so fleeting and few that we really cling on to them. But it really does make a huge impact on us, I feel like. But I do wish that like we saw these so often that they weren't so monumental. But I digress.
I know.
Another big thing that ties all this together with my identity that I really want our listeners to know is just how important it is to really advocate for patients, especially patients that come from backgrounds like ours, where there is that lack of representation. And that's something that I really think about a lot because I want to be a part of mending the system as opposed to just like buying into the system. And as Miriam and I both navigate residency applications and going into like this new step and chapter in our career, I really wanted to talk more about like what we hope to build in those institutions and how we hope to like promote this type of work going into these different places. I really feel like something that I've noticed, at least just talking in residency interviews, is how passionate and important it is to me to be involved with community clinics, community outreach, and like free clinic work, because that's really where like my community exists. And that's where they are the most integrated, is like getting those resources. And when I think of medicine, I think of like the real medicine that you do on the ground with patients who aren't able to afford all their medications. They don't have transportation to get to their appointments. They can't afford to get all of these expensive diagnostic tests. And when I think about those things, I think like, how do we navigate that with our patients? How do we get them those exposures? And sometimes we're very sheltered being at like a large institution where we order whatever test we want and we think of whatever labs we want and we just get it. We don't really think about the cost, although I think we are trying to be more cognizant of just how much everything costs, but it still is something that's just like easily disposable to us. And so as I'm navigating residency, I think a lot about like, well, what kind of exposures are you going to give me to community outreach? Who are we educating on our downtime? Where are we rotating? And like, how much integration am I going to get with those populations that I genuinely want to serve one day? And that's actually become like a big like deal breaker for me, is like, am I going to get that exposure? And do you all support that kind of work? I don't know, Miriam, what do you look for? What are you thinking about?
I think similarly, I think ultimately at the end of the day, it's really just about working with the communities, right? I say working with and building power with the communities, because I do want to emphasize, like, when you come from a background of people who are assumed to be health illiterate, just like a lot of people assume that, like, people in my family were health illiterate because English wasn't their first language, XYZ. There's a lot of assumptions that are made. And I think people will approach medicine in a way where they operate based on stereotypes. I think we all do it to some extent.
Yeah.
But I think that's kind of the danger of medicine. And so that exposure is really important. But I think building power with communities is also important, because you're working alongside people who come from those communities to really understand them and their stories. And I think Bundle of Hers has always been about storytelling. And I think storytelling is really powerful because it brings you into the nuance and the complexity of who a person is and what an experience can be like for a person based on their identities. And I think that was something that was really important for me moving forward. Like in residency, I think as we were applying to all these programs, it's so easy for programs to be like, we work with lots of patients who come from underrepresented backgrounds. But I was really looking at programs who like were in neighborhoods that were like communities that actually like within the communities, right?
Yeah.
And worked within community outreach clinics and with physicians, nurses, social workers, people who came from those backgrounds, right? And so it's like a two-sided thing, I think it's one thing, like, we should have the patient exposure, we should work alongside these communities, but then also at the same time, I think there's something to be said about having the people from those communities have more access to our healthcare system and more opportunities to become providers, physicians, nurses, XYZ, right?
Yeah.
Because at the end of the day, if you are not adequately representing, the communities that you would like to serve, there's a problem.
Exactly.
It's important for us to be able to like build a more robust community within medicine, not just for the patients we serve, but within medicine. Because Lily, you have the perspectives of growing up as Afghan. You know the challenges of having parents who don't speak English or didn't speak English as their first language initially when they moved to the States, or had all these like really unique traditions where they cracked a raw egg on your ankle and the yolks like didn't seem to like make it to your septic arthritis, but you understand like that gesture came from a place of concern and care from your mom, and you understand like the complexities and the nuance around that action. And I think that's really important, right? Because the provider that you probably had at that time, or any other provider, probably would have been like, what in the world? This mom doesn't know how to take care of like her kid. But that it's way more complex than that. And I think these stories are really important. I think these voices are really important in medicine. And I hope that with the new generation of physicians and healthcare providers in general, we are representing who we actually are working with in the community.
That is so beautiful. Just giving you snaps all around, because one thing that also really fuels me is hearing other like healthcare professionals say that they don't feel like their job or their responsibility or their role is to advocate for their patients. They feel like my job is to go to the hospital to care for those patients and then go home. And that's the extent of my job. And I think realistically, when we think about, doctors being these healers, even like back in like old history and where we all started, it was never that simple. Physicians used to go to the homes of their patients and like be very close and very personal with them. And a lot of times I think I do want a provider who's going to treat me the way they would treat their loved one, because that means that they're going to treat me to the best that they can. And sometimes in the world that we live in, simply going into the hospital and caring for that patient doesn't mean that you're giving them equitable care. And sometimes that means advocating for them at a larger level or being involved with the community, like you said, like growing those roots in those environments and with those people, so they know that you're not just here to like be a one-stop shop and then forget about them, and that at the end of the day, they're just another number in your list of people to see. And so I really think that the white coat privilege that we have is just naturally interwoven with the ideals of advocacy for our patients. At the end of the day, we have such extensive education and training into a lot of these concepts that whether or not you were raised and born in America, like medical jargon and terminology is so convoluted and complicated, and the healthcare system is so difficult to navigate no matter where we come from. But it's even 1,000 times harder when even knowing the basics of the language is so challenging that I think we're doing a disservice to our patients to not think that it's our role to advocate for patients. And I think a lot of times we do a good job of talking about it, but not necessarily enacting it, because that can be also pretty scary, being a thought leader and pushing the needle in that realm.
Yeah.
That's something that I want to continue like pushing myself and those around me to do, because I think we do have so much privilege in doing that. And so kind of just wrapping up this conversation today, I really wanted to tell the viewers at home and the listeners that we have that it's so important that if you want to go into healthcare, that you care about these issues, that you're passionate about your patient stories, that you want to practice cultural humility and really learn about your patients. It goes above and beyond just saying, I want to know my patient as a whole and not just as their diagnosis. It means taking that extra time to make your clinic run late so that you have that close tie to your patient, so that you get to have some type of meaningful bond to them. And more importantly, that when it comes down to it, you're respectful of that and you're able to take whatever that cultural practice is or that belief that they have and implement it into their care. Because I think that's where we really build those ties and build that rapport with our community that you don't just get by having that stereotypical physician-patient relationship with. And it's easy to say, but it's so much harder to practice when you're running through a long list of patients in the clinic and you know you're running late. But I want to push myself and I want to push everyone else around me to really take the time to do that and create that space to even have those conversations with your peers and call them in and call them out when you feel like a patient is being left behind.
Yeah.
Any other last words, Miriam?
That was beautiful. You're amazing. I was like, Lily's going to be such a good doctor. I can hear the humility in your voice as you talk about this, because you understand how difficult and challenging, not just emotionally, mentally, all those things, it can be to be an advocate for your patients. But I think the reason why I am not worried about you being that is because you grew up with those values inherent to yourself as an Afghan woman. And I think that is like kind of like one of the big themes of this episode is like how, you know, our identities have like really shaped our values and how we're in this system and we have to mold who we are a lot of the time to fit this system, because let's be real, it's a challenging system to be a part of. Yeah. But we also, as we get further in our training, have more knowledge, more information, and are able to kind of like enact on those values a lot more and be those advocates. And I definitely see that for you. And if I have any neuro patients, I'm going to be referring them over to you because number one, because I don't know anything about neuro, but also because you're going to be so amazing. And honestly, like, I'm very excited for your journey and for both of our journeys. I don't know. I hate whenever people are like, give yourself a pat on the back because it's cheesy and gross. But honestly, like, let's just take a moment and like celebrate not just us, but like the people who come from communities who didn't think they would make it in medicine. I don't know about you, but not a lot of people in my family really thought I would make it through this process. And not because like they thought I was dumb or anything, but because nobody in my family has been through it before. And exactly, I think it's really special to be a part of that process and pave the way for future generations. So pat on the back. Just kidding. That. You don't have to give yourself.
No, but for real, when I was like a pre-med student listening to bundles, I remember thinking like, how cool it was that I was seeing all these different identities, you know, speaking up in this space. But then I also kept thinking back in my head that like, oh, it's going to be so impossible and challenging and hard. And like, I don't actually see myself in this space. And so it's nice to take a moment to think, we are the doctors we wish we would have had growing up, and we're going to be that. And I know the viewers that are like listening to this, wherever you are, you're going to be that doctor for your community, and you're going to be that person that opens the door and lights up another patient's face. And I think it's just a ripple effect, and we're going to create a more like just system for our patients just by existing and caring deeply.
Yeah.
You know what I mean?
Yeah. Oh my gosh. Tears. Tears.
Not today. But that all being said, I wanted to thank all of our awesome listeners for tuning in to this episode. I wanted to thank Miriam for having this intimate conversation with me about something that's really close to me and so important, how it shaped how we entered medicine. And I really hope that you all hopefully got something out of this episode or felt like you were able to relate to anything that we were discussing. I'd love to hear more about your community and what your upbringing was like. So feel free to send us a message or DM us on Instagram. Otherwise, we hope you subscribe to our podcast, that you rate and review us, and that you tune in for our next episode anywhere that you podcast.
Yeah.
Bye.
Bye.